Good day, everyone. My name is Piet Jacobus, and I'm an editor with Healthcare Innovation. We are at HIMSS today, and it's my pleasure to be speaking with Weston Blakesley, Vice President of Clinical Intelligence at Dr. First, and Dr. Ben Long, Director of Hospital Medicine at Magnolia Regional Health Center. It's great to see you both.
Thank you so much. Great to be here.
So could you tell us what motivated the investigation of SMS text reminders in patients with congestive heart failure?
Yeah, absolutely. So we know that prescription abandonment is a major problem. As many as 1 in 5 prescriptions are never filled following a hospitalization. And as many as half of prescriptions through time are actually left at the pharmacy. And for patients with heart failure, which is a particularly vulnerable and costly population, we knew that the scope of the problem was huge, and we thought that we could impact that in a positive way.
Yeah, and another reason why we wanted to focus on this patient population is in your region, there's a high propensity of these types of patients. But the other thing that Dr. Long and his team have done over the years is being able to longitudinally follow clinical outcomes for these patients in an incredible way. So it gave us a baseline for the ability to actually test interventions to really prove out the outcomes as well.
So can you tell me more about the study and what the outcomes were of that study?
Yeah, so we did a 2.5-year long pre-period for our study where there was no intervention, and then around 2.5 years post, where we launched the ability to message patients with a SMS text, also with education about their medications, why it's important, and we tested the rates of which patients actually clicked on that intervention and compared that to patients that didn't click on that intervention too. What we were able to see is patients that actually engaged with the SMS nudges improved their medication fill rates by about 19% overall across all of our study groups. Some cases it was even higher than that. And they reduced their odds of getting readmitted to the hospital by about 6%. So we wanted to tackle this problem from a bunch of different angles, focusing on adherence, but also on the readmission part. But something that you and I always talk about, too, is how important compliance is as well, not just adherence. Do you want to elaborate a little bit more on that?
Yeah, sure. And something Wes said bears repeating. The engagement was incredibly high with this solution. Mind you, the setting matters. So we are a rural healthcare system sitting in the southeast United States. So many health disparities exist in the area, along with the very high prevalence of cardiovascular disease that Wes mentioned earlier. So we had greater than 90% engagement with the tool, which is almost unprecedented, at least in my experience working on quality improvement initiatives, particularly in an elderly population. Average age was 76 years old in a Medicare population. So we think that speaks volumes to just the ease with which we can reach patients, generate engagement, and then engagement equals behavior modification, which in turn I think improves their health.
Wonderful. Yeah, that's really good to hear. So how can this approach be integrated into broader care management or discharge planning workflows to improve medication adherence?
Yeah, working in the hospital, when I teach students and medical residents, I'll tell them often that discharge day is the most important day of a hospitalization. And that is true in that we believe that so much important instruction happens, so much assessment of the patients happens on that day. But through the years, I've noticed that much of that information is lost on the patients. And so much gets forgotten, so much risk of even safety events occur at the end of a hospitalization. So what we know is that medication-related errors are amongst the top safety events that can be measured in healthcare. So I think that any time that we're getting medications right, we are providing a service for our patients. So to answer your question, I think that the broader application is really endless when you frame it in that way.
Yeah. And also with all the work that you and your staff do to prepare, patients for the most seamless discharge, also by implementing technologies like this, it's kind of an extension to their care as well, because there are a lot of strategies to make sure patients can take, more ownership over their own, in this case, medication management, but also life gets in the way. They can forget to pick up their medications. They can also forget what their doctor prescribed them and why, especially in our patient population in congestive heart failure. Oftentimes patients need to be on 4 distinct medications to have the best outcomes. But we have even follow-on studies where we're measuring that compliance as well to make sure that these patients are on evidence-based prescribing regimens and they're actually filling them. They're actually getting better too. So by being able to insert interventions that happen after the patient leaves the hospital as well is very important reinforcement for all of the work that you do to prepare your patient populations.
Right. And I would tack on to that for this study, we're very intentional with the design, particularly in leveraging SMS for our patient nudge, as we call it. Required no sign-on, required no login, no extra steps for the clinicians. We know that really helps with the engagement piece. And it really kind of comes back to, I think, you want to make the right thing to do the easiest thing to do. And I think that this study highlights that principle nicely.
Very good. Good news. Wonderful. Thank you so much for speaking with us today.
Thank you.
Thanks for having us.
And thank you so much for listening in.